orthopedic surgeon, but what are orthopedics in general? So pretty much what orthopedics is the branch of medicine that focuses on the corrections of deformities within the muscles, ligaments, bones.
So you're pretty much doing a lot of work on stuff like that, and pretty much the entire body and whatever you specialize in. Also doing work on the muscles on your entire body. So muscles like these, and also joints and ligaments that help you go like this and flex those muscles. What an orthopedic surgeon is a surgeon who conducts various procedures, surgeries, and processes on the musculoskeletal system and the skeletal system. A question I ask myself sometimes is, am I even close to being prepared for this career? Evidently, there are some skills that I have that may pose useful. One skill is that I'm great with explaining my ideas to others, and communication is a key skill when you have to speak to your patients, doctors, and other personnel. Another skill is that I have prior and generally minor knowledge on various injury recovery methods, since I'm always asking the high school athletic trainer for tips. Final tip I might mention is that throughout high school, I've learned to use my skills in a competitive and steady environment, and this is effective because it works in medical school. And that's enough about me. Let's get into the career requirements that you need to become an orthopedic surgeon. I'm 18, and all I have is a dream and a high school diploma in order to start my career. My first step is to enroll in a college or university in order to earn a bachelor's degree in the sciences. Now, there is no specific bachelor's degree program in order to get into medical school, but your major should be concentrated heavily in the sciences. Also, volunteering at hospitals, studying abroad, and any work done in a medical setting is really important when you're getting ready to take your MCAT. An M what? The MCAT is the Medical College Admissions Test, a 7.5-hour exam that can make or break your way to medical school. Work long enough, and I studied hard enough, I'd be 22 years old, and I'd be ready to start medical school. Now, medical school is a 4-year program that prepares college graduates to work in the medical field of their specialty. It's almost split up into two. The first 2 years is more in detail academics. The final 2 years deals with specialization and clinical rotation. So at this time, I'd be about 26 years old, and I still have a few more years to go. I'm not done yet. The very next step is to pass your USMLE, the United States Medical License Exam. Think of this as an MCAT in order to conduct clinical and medical research in your field. At this point, I'd be almost done. Well, not completely. My very last task is to complete what's known as a residency. A residency is a 5-year commitment that prepares doctors, surgeons, and nurses to start working in their field. This is when you start getting hands-on working experience with experienced surgeons on patients to become an expert in what you do in your field. At this point, I'd be pretty used to exams, so you have to take one more written exam at the end of your residency in order to earn your certification. Long years are finally over. I'd be 32 years old and given my certification by the American Board of Orthopedic Surgery. Okay, so now let's talk about the direct cost and the opportunity cost in order to get into this field. With opportunity cost, one thing you're going to have to sacrifice is other jobs that you can get in the medical field, such as a PA, physical therapist, etc. Direct cost is going to be debt, of course, from medical school, residency, college. That's going to leave you in a lot of debt if you don't have financial aid. The biggest question arises, how much do I expect to make in income throughout my entire career? If I retire at the average age of 66, I expect to work 34 years in this field, and I'm probably not going to look like that, but it's a little diagram. Taxing as a single filer into consideration, I get an average pay of $460,000 a year, so I would fall in the 39.6% tax bracket. So when I fall into this bracket annually, including tax, I would make about $278,000 a year. Finally, over the 34 years, the income I expect to make in my working lifetime is about $9,453,000. Keep in mind that the estimate below is a huge overestimate because you have to take into consideration other outliers. The next thing I'm going to talk about are the trends in the orthopedic surgery job market today and in the future. So on a negative note, according to Helio Orthopedics, the proportion of practicing orthopedic generalists decreased from 44% to 28%. Reasons why this decrease is happening is because one, medical school is becoming more expensive, and two, the competitiveness in the job market is excelling. More positive note, the decrease in those who practice led to an increase in orthopedic job opportunities. Now let's talk about the future trends. There will be future changes in healthcare reform that will cause hospitals to cut their workforce. There will be limited job opportunities for surgeons in the future. On a positive note, there's a higher demand for experienced surgeons since there's evolution in chronic conditions which require more experienced surgeons. A lot of benefits and opportunity costs when going into becoming an orthopedic surgeon. But why am I so passionate about this in the first place? The reason is mostly personal experience because there have been many times where I've lost loved ones because of the unavailability of surgeons and their incapability to treat. The second reason why I want to go into this field is because I love learning about the body and I enjoy working and talking to people about the topic. The last topic that I'll get into are the benefits and the negatives when going into orthopedic surgery. Starting off with benefits, according to Chron.com, orthopedic surgeons are among the highest paid medical professionals in the field. You receive a status as one of the most highly respected workers in medicine. You get long breaks with 4 weeks of vacation, up to 4 weeks of sick leave. One of the last things that I really like about this field is that you can specialize in whatever you'd like to do, such as a foot surgeon, a hand surgeon, elbow surgeon, etc. Now to talk about the negatives. So I think what scares a lot of people from this field is that it takes many years in order to get your certification to even become an orthopedic surgeon. Responsibility might also be a negative because it's highly possible that there will be times where the life of your patient is in your hands and you need to be responsible for the job. The final negative that I looked up on are there are new policies in healthcare where orthopedic surgeons end up doing more paperwork than seeing their patients. Now I say all of this because this is really important to understand that there are benefits and also negatives when going into every type of field. If I play my cards right and do everything I need to do, hopefully I can become the orthopedic surgeon that I dream to become.